So we're here with Leslie Plyler, and she is a first responder, and we appreciate you being here today, Leslie. And thank you for what you do, and someone thought highly enough of you to nominate you for what you do in our community. And so the first thing I want to do is tell us what you do.
I'm an RN with my bachelor's degree, and I'm the nurse manager at Carolina Medical Consultants. We're an internal medicine practice in Rock Hill. We service all the communities: Lancaster, Chester, Rock Hill, Fort Mill, even Charlotte. I'm over the nursing department as well as the lab at the office.
Talk to me about your family. You have children.
I'm married to my high school sweetheart. We started dating in 1993. We got married in 2000, right after I graduated from nursing school. So this is we just celebrated our 20-year anniversary, and we have 2 children. My son Caden is 15 years old, and he's a wonderful story all his own. He was adopted when we thought that we were never going to be able to have a baby, and then lo and behold, 3 months after he became ours, I got pregnant with my daughter Courtney. So we have a beautiful family.
How did you get into nursing?
I was valedictorian of my senior class along with 2 other girls. We kind of raced the whole way through high school, and I wanted to go to medical school. I went to Erskine for 2 years, and during that time, over the summers, I was working at Springs Memorial at that time, not in USC, and I got to go into doctor's offices. They needed me to rotate in and help out when I wasn't in human resources, and I absolutely loved the nursing part. So after 2 years, I transferred to the nursing department at USC in Columbia and got my bachelor's in nursing.
Right now, we're in pretty difficult times. We've got a coronavirus pandemic. And so talk to us about that and how that's different from everyday practice in nursing.
We had to figure out a way for us to see sick patients out of the office, well patients in the office, because patients still needed to come in.
Right.
We're not a sick medical office. We're a medical office that you do your follow-ups and your chronic conditions and your well visits, and those needed to go on, but we needed to do it the safest way possible, and we've had to adjust. We met every single day as physicians and the 2 managers every day in March and April to change what we were doing, to update. We looked at DHEC every day. We looked at the CDC every day to see if there was something that we needed to be doing that we weren't doing.
Because I knew as a community and as a nation as a whole, this has been very, very stressful. You've seen the economy come to a grinding halt. You've seen people wearing masks, social distancing. Talk to us about the stress level for a first responder, and then the people that you see.
I think first responders, I have tons of friends that are nurses, and we all worry. We worry that we're going to bring it home, or we worry that we're going to get it. We worry that we're going to be the one in the hospital that doesn't have anybody with us, or our child could be the person in the hospital that doesn't have anybody with them. So stress levels have been, like I said, quadrupled. We see it in our patient population. I would say more so in the elderly, because they miss the interaction. Sometimes the doctor's office is their main interaction. We have patients that would call us, that like to call us every day, and them not being able to come in. The elderly population really has been hit with this, but so is the younger generation. I know my kids. They see my stress level. They know that we're not in school. Mom's not getting home until 7 o'clock. We're Lysoling everything we've got. So it's been really hard. I mean, across the board, all patients they're scared to come in. When you said that about the economy, we even though we were being as safe as possible and keeping the inside of our office, I mean, as disinfected as anything could be, patients were scared to come in. So I mean, it really dropped our production or whatever, our bottom line, because patients were so scared to come in. That's getting better now. They've got their mask and they feel more comfortable. And we really stress to them how they're going to be okay coming into the office.
For me, and I guess for everybody, I mean, they call it the novel coronavirus. I mean, it's new, there's no vaccine, there's nothing to take the edge off of it. And so the unknown's a big fear for people. What have you seen in that as far as now we have more data and we have more information? How are things now versus maybe 3 months ago?
3 months ago, patients were, they didn't have masks. They weren't washing their hands. This was all new. They were sicker. There were immunocompromised people out there that didn't realize that they needed to protect themselves more. And the majority of the people that were getting tested were the sick people. 3 months in, you have insurance companies and the CDC and hospitals saying, come get free testing. So you've got well people getting tested as well, and they can be carriers and not have any symptoms at all. So you've got a more well population that is testing positive. So it kind of skews the numbers a little bit. Yes, there are very sick patients still out there, but I think that with the everybody gloving up or wearing masks and everybody washing their hands and all the strides that the communities and the cities and the towns and the state have taken to try to make people healthier, it's worked. I do feel like it's not over yet, but the patients are faring better. They're doing much better than when it first started.
The environment that you're in as a first responder, a nurse, versus an emergency room, or people going out and seeing people that you typically think of as a first responder. Tell us about your environment and what goes on there versus some of these.
As a doctor's office, we're seeing everybody. We test constantly. We provide the best care we can for every level of patient, inside, outside. So the doctor's offices are just as working just as hard as the ER. It's a group effort. If we have a sick patient, we have to call EMS. Then we have to call the hospital. So to let them know that the patient's coming. We work as a group. All the first responders are. It's just a big supported group of people that we just want our patients to be well, but we also want to keep ourselves well.
I want to thank you for being here with us and sharing with us on what you do and what you're going through. And there's a lot of misinformation out there. There's a lot of trying to decipher information, and when you've got the #1 health expert, I think his name is Fauci, has been giving us a lot of information. He's got a 73% approval rating. I'm sure he's doing the best that he can, but his information has been kind of all over the board. And so it's good to have someone local, someone that we know and that we can trust to get this information from. So thank you for being here. And is there anything else you'd like to share with us?
If you have questions about COVID-19, make sure that you're speaking with your primary physician. Make sure that you're just looking at South Carolina DHEC. Make sure that you're just looking at the CDC. Do not go by what the news says. If you have a question, call your physician and ask them, because there's a lot of misinformation out there and there's a lot of skewed numbers, and social media is definitely not the place to get your information from, your COVID-19 information from. Always, always, always go to your healthcare provider.
That's perfect. Thank you so much for being here.
Thank you so much for having me.